Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echovascular, general, high-risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. The poor access to healthcare in developing countries remains an overlooked cause for many global issues, including poverty, inequity, and the impact of natural disasters and climate change, conflicts, and migration, just to name a few. Women, especially mothers, have a pivotal role within families and their healthcare. Hence, maternal mortality reduction is the number one goal for health of the United Nations in 2030. Sustainable Development Goals. Keeping universal healthcare in sight, Dr. Stephan Holler is dedicated to support this goal. He does so through Life Matters International, a nonprofit organization dedicated to reducing maternal mortality and improving prenatal care in low-resource settings. Its work is dedicated to establishing self-sustaining and scalable healthcare improvements in some of the far-flung, underdeserved areas of this world. I arrived at this juncture after many years in the field of medicine as a passionate learner in diverse and often challenging healthcare environments of equally diverse locations on the globe, says Dr. Stephan Holler. Empowering remote and underserved local communities through their amazing health workers to leverage technology and improve maternal and child health outcomes may be challenging, but seeing what is possible has turned it into what is probably his most rewarding endeavor. Please help me welcome Dr. Stephan Holler. Thank you, Dr. Holler, for joining us and talking to us about your mission in life and how your education in doctorate of radiology is kind of transpired to a new mission for your life. Tell us a little bit about yourself.
Well, thank you. First of all, thank you very much for having me here. It's great to be on this program. And yeah, well, thank you for the introduction too. Well, I was born and raised in Germany. I became a physician in Germany. I spent some time in the military there, and I was a primary care physician for a few years. And then I got exposed to radiology. And when I left the military, I came to the United States, did my residency here. And then I worked as a radiologist for the last, since 1995. So that's now, almost 30 years. And 2 years ago, actually, 10 years ago or so, I started doing medical missions, going to third world countries to try to make a difference, and realized it doesn't really make that much of a difference. It's all very temporary when you go there for a week and take care of patients, which is nice, but it doesn't change really the conditions there. So 3 years ago, a little more than 3 years ago, we came up with this concept of doing missions where we train healthcare providers in third world countries and hoping to make a real difference. In other words, equipping them with the means to help their own people better, rather than instead of them taking care of people for just a short period of time and then disappearing again. So then I was working at Kaiser Permanente at the time, and I took early retirement from there in order to do this now. So now we do this full time. We go through the Philippines several times a year, and in between we check, what those people do with their learnings, and we're growing. So it's been a really exciting ride.
Exciting. Yeah. So the mission that you're talking about is Life Matters International. That is a 501(c) nonprofit organization, and it's based in San Francisco Bay Area, right?
That's correct.
The mission is to reduce the number of women dying from preventable causes related to pregnancy, which remains unacceptably high, especially in developing countries like the Philippines. So, is there a reason why you specifically chose the Philippines?
There kind of is. I've been doing medical missions for the last 10 years in several parts of the world, but somehow in the Philippines, there is I guess because of the circumstances here in the Bay Area, there's a lot of Filipinos here, a lot of Filipino expatriates in healthcare, and they like to go back and try to do something for their people that they basically left behind. And that's how I got more familiar with it, and I became very familiar with the Filipino culture. So when we started this project, I said, let's go where we are most familiar with the culture, so that we don't step onto toes. We don't make mistakes that are basically based on not really understanding the culture. So that's key. I mean, we have to work with the people there and have to use their understanding of healthcare and of health in order to help them. Because again, we want them to embrace it and multiply it, for their own people.
Right. Yeah, I think the knowledge and understanding of the people and their culture is vital, right? To
absolutely
in any kind of forward motion, in any of that. And it's quite astounding to hear, that there are other parts of the world where there's that much death in childbirth, right?
It's a big problem. It's a big problem across the world, actually, and that's one of the reasons why the United Nations has made this like the first goal for healthcare. These sustainable development goals. Many people have heard about the Millennium Goals of the United Nations. Well, they were not reached in health, so they came up with these sustainable development goals for 2030. And as far as health is concerned, the first goal is maternal mortality, because I guess, the United Nations understands that, if mothers die and the children die with them, or the babies die with them, not only is this a tragedy by itself, but it's also a tragedy for the family. Many families collapse when the mom disappears or when the mom dies and there's other children there. The dads can't handle it. The children end up on the streets. Poverty just basically becomes worse. Yeah, exactly. So that's the number one goal. And that's why we said, what can we do to address this goal? And being a radiologist and being, involved with ultrasound, that was kind of the natural thing to do, because ultrasound, it's been around for 50 years or more, but it still hasn't really made it into the peripheral parts of developing countries. So that's what we're working on.
So you have three main objectives with this.
Yes.
Right. Enhancing the prenatal care through the point POCUS, right? Point of care, ultrasound, training the nurses and the midwives and other birth attendants, right? Effective disease prevention by educating mothers, and building local capacity for long-term sustainability by teaching teachers with emphasis on quality assurance. That's a big mission. That's a big project, right?
But I mean, you're a sonographer, right? So
right.
And basically we've all been there, right? I mean, if you're a sonographer, you've probably had some students at some point, and you start teaching, and you realize that you can make a big impact. Most people don't understand ultrasound. They don't even know what's good for. They don't know what we're looking at when we're looking at ultrasound. So we've got a lot of work to do.
Yeah.
So yeah, we the number one is, we want to get those numbers of women that die down. And one of the major challenges in these places is distance. So for instance, in the places we go to, which are like far-flung islands in the Philippines, if a mom gives birth there, let's take the worst case scenario, which is not uncommon, is she gives birth there at home. She starts to bleed. Then nobody knows what to do. The next hospital is, a 4-hour boat ride away if the waves are not too high to prevent that boat ride.
Right.
By the time she reaches there, she's pretty much dead. So by doing this, we're trying to prevent all those things that can cause problems at the time of birth that we can identify before that. And that's mainly, the big ones are placenta previa, twins that were not suspected, right? Or an abnormal fetal lie where the baby cannot come out. And so all these things we can find with ultrasound, right? Long before it becomes a problem. And that's what we're teaching them, so that they can then do the 4-hour boat ride when they're not bleeding yet, and get treated by cesarean or by whatever they need. So that's the main goal. The second one is, we want to, while we have the moms there, they get the ultrasound, we want to make sure that they get taught properly about what they can do to prevent things. That means, hygiene, diet, all those things that are important for the well-being of the mom and for the baby. If we teach them at that time properly, then that can be translated to the whole family, right? Because what do moms do? They take care of babies, their husbands, the mom, the grandma, the grandpa, and maybe the auntie and the uncle who lives in the household. So
right. And so then they teach others, right? They teach others how to do it.
Yeah. So that's a big part of our program. We teach the midwives to not only become proficient in POCUS, we teach them to teach others. So like the first place that we went to, there's always 2 midwives coming with us who now teach other midwives. And we make it a point with each community that we go to that they give us 2 people for each medical mission to go along and teach others. So this way, when people in the community that we have taught are leaving and new ones come in, they will be taught by those that stay back. So this way it stays, and by teaching others, it's like a snowball system. It kind of carries on further.
And so how long are your missions typically?
Typically, our missions are a week long because people don't have a lot of vacation, right? Sonographers don't have a lot of vacation. Even physicians don't have a lot of vacation if they're not like, in private practice and making tons of money. So, so we're doing week-long missions, and that's actually enough. So this eye-hand coordination that, sonographers are so good at, that's what we are trying to teach them at first. So we teach them those baby steps. 1 week is enough to do that. And then we let them practice. We let them practice what they can do for months. And they send us all their images, and we check them, and we give them feedback. This is what you can do better. This is what you should have done there, or blah, 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 blah.
Okay. And
then after a few months, we go back. And then we kind of know what their weaknesses are. And then we go with the next steps. We show them like the next step. Like, for instance, we make them look at the cervix. Okay, look at the cervix, compare it with the lower end of placenta so that they can detect the placenta previa. Things like that. So then they move on, they get better. And then we look at those who are really good and fast learners, and some are slow learners. But what we found is that slow learners are not necessarily bad learners. They will still learn it. They just take longer. Usually those are the older ones that have been midwives for a long time and they're kind of critical, don't know whether they can do that. They actually can if they want to. I mean, we had like 100% graduation rate on our first at our first place that we went to. So
do they have technology there to learn?
Good point. Excellent point. So what we found, we were trying really hard to get a lot of donors so that we can afford ultrasound machines that we can bring there. And the important thing is you should bring portable ones, but not necessarily handheld machines. Right. So that's the key about hardware. The handheld machines are good. Some of them are fantastic, like the GE machine or the Philips machine. They're really spectacular. They get great images. We work with Clarius too, which has a very nice AI feature. But once the idea for us is we introduce ultrasound to them. We decrease the number of women who die. But also, once they do have ultrasound, the doctors, the few doctors that are there, will be able to learn other ways to do POCUS, right? To look at the gallbladder, looking for kidney stones, the simple stuff. You know, the e-fast exam that they do in ERs, they often have to do that themselves because they have emergencies too. So for that reason, the handhelds are probably not so good. And that's why we advocate the laptop size. So laptop size is ideal, it's portable. They can take it into the most remote village, and they have the quality that they can expand their ultrasound use with.
Awesome. So then they have technology that they could YouTube or look up things in order to learn.
Yes, absolutely. And because once you have that eye hand coordination, you know that as a sonographer, right? Once you have your first registry, the others are just a question of learning, right? They're not about how to do it. It's about learning. And that's exactly the same thing for a doctor who does POCUS. You know, once he's good at doing like prenatal POCUS, you know, he can learn the gallbladder POCUS and the kidney and, you know, EFAST and you name it.
Right. Yeah, that's amazing. So you're really affecting healthcare overall. Not just elite, right? You're
absolutely right. That's the big picture. The big picture is like a country like the Philippines, for instance, they want to do what we in the United States do not have, which is universal health care. And in order to do that, they have to empower, you know, the primary care physicians in the far-flung villages to do things that, you know, they cannot do at this point.
Right.
And that's where this ultrasound really helps, because it's the only imaging modality that is portable and can be brought in those areas.
Right. Which is huge. I mean, what an impact it would be just to bring ultrasound of all modalities to there, right? I mean, we can't solve all problems, right? Or identify all issues, but we can at least start there to rule out some of the major issues.
Okay.
Well, and do you find that they're motivated to want to learn?
That's actually a very important point. And that's where culture plays a big role. Believe it or not, the training in the Philippines for midwives is actually pretty good. It's English, which is nice. They do have their own language, Tagalog, but the training is all conducted in English, which is helpful. But to motivate somebody who has been doing a job for a long time to do something completely new and something that looks really difficult to do, and at first is difficult to do, requires a challenge. And there are several aspects to this. One of them is to overcome the initial thing. The initial thing, the initial hurdle, mental hurdle, is basically just by when we are there and holding their hands and show them that they can do it, that they just have to practice. That does quite something. We found out there is kind of a slump after the first visit. because they're not there yet. They don't have the confidence yet, and they're still struggling. So those first few months after the first visit, they're really crucial to motivate them to let them go. And one thing that works well with Filipinos, we found, is they're very competitive.
Ah.
They don't like to be left behind. They don't want to be less than the other. So what we did is we pair them up. We say, two of you scan the same patients. And that kind of helps. First of all, it helps when somebody is weaker and the other one can help.
Right.
And the other thing is I want to do it better than you. Okay.
Right.
And that kind of, it's surprising, but these things play a role in, it's a psychological piece. So that's help. That's when it's helpful to know the culture.
Right.
How they are. And one other thing is that we do is we sponsor the good ones, number one. So those that are really good and want to, we sponsor them to get a certification, an international certification through POCUS. And then there's also the carrot that we pay for them to travel to other places to teach.
Oh.
Because Filipinos don't have. I mean, sonographers don't earn. Some earn a lot of money depending on where you are in the United States. But in those areas, these people, they don't earn very much. Midwives are the lowest paid healthcare worker, and that's why there's plenty of them. Okay. So they don't have the money to travel around to teach other people, and that's where we need our money for, to kind of sponsor them so that they can go and teach the others, which is really a key part of our program.
So then if you go for a week, and then how long do you wait till you go back for another trip? I think previously in our conversation, you said you had 4 trips, I think, planned for next year.
Well, we have 4 trips planned for the next year where and that's correct. So usually, to answer your first question, we wait a few. We found that the sweet spot is somewhere between 4 and 5 months. So what we try to do, and it's also, people, if you go too often, then they become dependent on what you do. Okay. Right. So you have to space it out a little bit. So we found the sweet spot is really 2 visits per year. So usually what we try to do is we try to go early in the year, and then we try to go late in the year. Okay. And usually we do 3 visits, 2 working visits, and the 3rd visit is make kind of a quote unquote graduation visit where we kind of celebrate what they've achieved. We give out the invitations, we give out the stipends for those who want to get certified and so on. So yeah, so it's usually we go basically next year we will go in February and in August. Okay. That's kind of also, we kind of set it up this way so that I don't have to travel 4 separate times. We try to kind of bunch them together a little bit. So I only have to go 2 times.
Okay. Okay. So you go for 2 weeks, right?
Yeah, I usually go for more than that because my job is not only to supervise the missions, but also to kind of prepare the next ones. Right. And follow up on previous ones. And then, I have to talk to the people. We have to work with the local governments. You have to make connections. All those things, take time.
Right. Have you found any resistance or any extra things they have to overcome in regard to their government allowing you in to teach their people, or?
There is a few things that, you have to, and that depends from country to country. Corruption, this is not, it's no secret. Okay. There's a lot of corruption there. Okay. Right. So, and we don't have the money to pay people, okay, to pay people extra money that they want to put into their pockets. So you have to kind of walk a fine line. And the thing is, there are elections there every 3 years in the municipalities. So what you need to do is, or one of the reasons, maybe put it this way, one of the reasons politicians like medical missions is they make them look good. So they can tell that people, oh, I bring you doctors from the United States. They bring fantastic healthcare to you, and they take care of you. So they can get elected again. The other thing is they try to save money with these medical missions. Okay, so if they have doctors coming in taking care of the people, they don't have to spend the money to pay their own doctors, right?
Right.
So we don't want to support that. We don't want to support that latter part. So we have to focus on the first part. We have to focus on, we are going to, number one, we're going to make sure that you can tell your people fewer moms will die. Okay, we will save your lives. Okay, we will improve your healthcare.
Right.
And the mayor, I'm the one who's doing this. Okay, so that kind of is the way to move things. There are many hurdles. Just like in this country, POCUS, radiologists are not particularly crazy about POCUS. Neither are OBGYN doctors.
Right.
So there are some questions about that.
Ultrasound techs aren't either, by the way. We're not that crazy about it. So,
well, there's an interesting part to that, which each time we encounter this, because we have been in towns where there was an OBGYN, where we go, the people who don't get ultrasound exams, they will not get it whether we're there or not, because everywhere is fee for service. They have to pay for it. Okay. So what we found, actually, and we could prove that, what we found was, if we teach those midwives to do the ultrasound, all they can do is a POCUS, right? All they can do is, they're not making a diagnosis. All they do is they make observations. So they observe that the heart is not beating anymore, or they observe that there are twins, or they observe that there's a placenta previa. But what is the next step? The next step is, it has to be confirmed by a diagnostic study.
Okay.
So in other words, we could tell the OBGYNs, we said, look, we've shown in this municipality that actually, because of what we did, you got more referrals because more people had an ultrasound than before.
Okay.
So that solves the money question.
Okay.
But most, when you think about it, nobody thinks of it this way. Right. Everybody is afraid they're going to lose the profits.
Right. So yeah, still very political, right?
Yes. Yes. It is.
Too. Wow. So you're focused mostly on just the Philippines at this point in time, right?
At this point in time, yeah, we're growing. We actually expected, we had requests from places like Cambodia, from Mexico. The thing is, we're expanding in the Philippines now. There's quite a lot of demand. A lot of municipalities are coming to us and they wanted to come to their place. That we said, okay, we know the place now, we know the culture. Let's continue to work here for now, until we have reached a certain level of competence where we can turn the whole program potentially over to the local government.
I have had a personal experience going on 2 medical missions to Honduras.
Mm-hmm.
Met some of the same resistance as you've spoken of, they've now allowed like tons and tons, like the airplane was full of all medical teams of all different kinds, orthopedic and cleft lip and palate and all sorts of teams, OBGYN. I was part of the OBGYN, all these teams of people who would go in and they just fix what's there, right?
Right.
But there was no training, right, to empower their people, right?
When they're gone, they're gone.
Right. And so another time I went over there and they had excellent technology. Like they had a really good ultrasound machine, and just not someone who really was aware of knowing how to use it,
How to
right?
use it. Yeah.
So, that's the other.
You hit the nail right on the head. I mean, that's where we can make a difference if you go there and repair a cleft lip or something. That's
Right.
fine. But again, if you leave, it's it goes back to zero.
Right.
So
Right.
and we found the same thing that you found in some, not all, but in some municipalities. We found that somebody like 10 years ago, a Japanese company came and they left an ultrasound machine
Right.
because they thought this is good for them. And now it's like used as a table for
Right.
other stuff.
Right. It's like
Because
treadmill
nobody knows how to
for
use it.
Americans, right?
So, which is actually great. Which is great because we can use that much now. All of a sudden, like one municipality we go to next year, they have 3 ultrasound machines. They have one was donated by some nonprofit, one was donated by Rotary, and one was by a Chinese company that walked by, which is a handheld. So they have 2 laptops and one handheld, and they don't know how to use it. Okay, so we don't even have to do much as far as hardware is concerned,
right?
In places like, and that's how I think that's where medical missions really need to go, into that direction, where we share our expertise rather than doing stuff that they can do themselves.
Right. Yeah, it's heartbreaking that they can have such great technology and not be able to use it to help their own people, right?
Yeah.
Or some places they really did have someone who would sit and actually read the manual of how to use that piece of equipment. They probably knew more about how to use that equipment than I did, because they read the manual, so that was interesting. So then there were other needs there with that particular individual,
Yeah.
but they're more than capable of learning and wanting to learn,
You're actually hitting a very good point. You're hitting a very good point that we found too. Each place is different. Not every place is the same. You can't use like one thing for all. One shoe for all. It doesn't always fit. So one of the things, and that's one of my job, one of the things that I do during those weeks when I'm there, is I go to the places that ask us for help, and I look, what is it really that they need? Is it just the ultrasound knowledge, or is it technology, or do they need to update, or do they need something else? That's a very big piece, and we make a very careful decision before we go somewhere, so that we don't want to waste our time, right? We don't want to waste our time. We don't want to waste go there and then nobody wants to learn, or they have already learned it. They have really different issues. So it's important to kind of vet the places you go to.
Right. Absolutely. Yeah. It was a very fun, exciting, interesting 2 trips. Security. Do you ever have problems with security, or do you need extra security when you're there, or?
There's a lot of stuff being said about security in the Philippines, but in general, where we go, there's really no issue. The reason is there's no interest there, because the places that we go to, they're poor. The only interest there is tourism. Like, some of the islands that we go to, they're really like paradise islands with the most beautiful beaches you can imagine, and they're deserted, but the people are desperately poor. So we have not been to an area that is known to have any violence. And if there were areas, we would avoid them. In the Philippines currently, there are very few areas that are with such reputation. And I think the other thing we try to do is first of all, we come in relatively small groups. We don't come in. I mean, our maximum is like 12 people at a time, and then we try not to we try to stay where we can stay, and we try not to flash, money around. So the thing is, if you do a mission and you bring a lot of stuff that you then want to distribute, that attracts bad people, okay? Because they want to get the stuff and sell it. Okay,
Right,
very
right,
simple.
right.
So all the medicines that you dole out at these medical missions, you have no idea what happens to them. The people may be so poor that they sell them, or they may be robbed, or they may have to give it to the elder of the village because he has to pay him off for some favor he did. All this stuff that is going on, all this we kind of avoid by just teaching them knowledge. Knowledge transfer, I think, is the key to development.
Yeah.
Really.
I agree.
And all the sonographers that so far that have joined us, they can all testify to the effect we have. And we've had some really terrific people, I have to say.
What about any kind of virtual follow-up? Do you ever do any of that where you have like a Zoom meeting with them or something?
Absolutely.
Follow-up?
Yeah, we follow up, and actually we start with that even. We actually, our first session is a theory session that we do in Zoom, but we kind of first get to know everybody a little bit.
Okay.
And then like I mentioned before, during those months when they practice, every single exam they acquire, they send the images to us, and we critique them, all of them. So they get feedback that way. And
how do they send the images to you?
Say again, please.
How do they send the images to you?
WhatsApp.
WhatsApp. Okay.
Yeah. Okay. They're basically de-identified. There's no identifiers on them. They're on WhatsApp. That's still secure, and we don't need to store them long term. It's POCUS. We don't want them to be stored long term. It's basically a tool. It's just like, if you think about it, they're using ultrasound already, right? They do their Doppler to find the fetal heart. Well, that's ultrasound, okay?
Right.
That is ultrasound right there. So we're not introducing anything new to begin with. So we use WhatsApp, which works pretty well. We then look at it on a computer. We have some ways to kind of make it easier. All these things, we had some issues initially with that. Well, every new approach has issues that they have to solve, and we solve those. So it's running very smoothly right now. We actually have more sonographers that joined us and do this remote stuff, then joined us to go on mission, because many have children or other reasons why they can't go on mission, but they support us by doing that what we call QA.
Awesome.
Yeah.
Awesome. Yeah. Yeah, I'm looking forward to maybe going with you on a trip sometime soon and hopefully get some experience there. I know my trips to Honduras were life-changing, and in a lot of different ways, right? So I think it's just really valuable to, as a human, experience another culture and realize we're all human, right? We're all people, and they need health and care just like we do,
Absolutely.
So
Absolutely. I mean, there's a reason why I've been doing this for over 10 years, even before we started this, because, and that's probably one of the problems. Many of those missions they're so enriching to the people who do them, who go, that it's such a great experience. And you're more than welcome. You're invited to join us anytime on any of our missions. And anyone who would like to join us, we the only condition we have is you have to have your OB registry. That's all you need to have. So,
yeah.
or the foreign equivalent, because we have people from Australia who join us.
Okay.
Yeah.
Yeah. Awesome. Well, thank you so much for your time and for your expertise and for your mission and for your motivation to enhance our world in general, right? And with medicine, what fantastic life experience. And I'm sure there's lots of struggles, but I'm sure there's also times of great satisfaction for being able to enhance someone's healthcare.
Yeah, it's very satisfying. It's very satisfying. It's challenging, but it's very satisfying.
Yeah. So thank you for your contribution to our world and to ultrasound and to other people. We are extremely grateful to have people like you in our community to reach out to and to be a part of. And um, I'm just so grateful for the missions that I've been on, but I'm looking forward to the mission I'll be on with you hopefully soon.
Sounds good. Thank you very much, Debbie, for having
So
me on your
much.
program, and for those kind words that you just said. Thank you so much.
Quite welcome. Thank you.
Looking forward to working with you in
Thank
person.
Yes. Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.